Join us in this segment of the Global African as we explore the ongoing conflict in Darfur and its particular impact on the women of the region. The second segment focuses on Ebola, and specifically the way that it was addressed in the city of New York. Sit there, join us. This is going to be a great episode. Sudan was once the largest country in Africa. It's a country that has for decades been immersed in civil wars, one that ultimately led to the splitting of the country and the creation of the South Sudan, and another that continues in a region called Darfur in the western part of the country. In Darfur, there have been human rights abuses, there have been massacres, there's been violations of the basic rules of war, as a government based in Khartoum has utilized ethnic conflicts as a way of suppressing the indigenous population of the region, using an organization that's known as the Janjaweed. In Darfur, women are one of the main targets of the repression. And in fact, what has happened is that rape has become a major instrument for suppressing the indigenous population of the Darfur region. The people are, of course, fighting back. The issue of Darfur has been brought to international tribunals, but the struggle, in fact, continues. And today we're going to explore that in some depth with our next guest. We're joined by Niamat Ahmadi, the founder and president of the Darfur Women Action Group. Thank you very much for joining us.
It's my pleasure.
So, Darfur, for all intents and purposes, seems to have vanished, at least from the media. I mean, we don't see almost any reference to Darfur at this point, even though several years ago it seemed to be the only thing that was in the press. What exactly is happening, and why has it vanished?
Well, you're absolutely right. As you said, Darfur is no longer in the news. Unfortunately, the situation is really as bad as back in 2003 when the genocide started in Darfur. Today it's 11 years, but we still have over 3 million people who are still living in the internal displaced camps. Over 1 million, these are refugees who fled the country either in Chad, Central African Republic, or in Egypt, Jordan, and they scatter in many other countries. And there are many more who have not been counted, who have fled Darfur to other regions within Sudan itself. And the humanitarian organizations were expelled by the President Bashir in 2009. Today, there are only few agencies that are confined to the major cities within Darfur. They can't reach the needy. People are dying every day, if not by bullet, they are dying from malnutrition, lack of medication, lack of trauma counseling and psychosocial support. You cannot just imagine how the hard it is for our people staying in makeshift camps. They are not camps anymore, but it's a makeshift shelter that they created from the plastic sheets that cannot endure either like the heat of the sun or the cold of the winter. So this situation is really bad.
It might help for our listeners if you summarized what's the central struggle going on in Darfur. What is the conflict? What in essence is the conflict about?
The root cause of the conflict is the racial genocidal attack of the central government. These are the central government that led by Arab elites in Khartoum, in the north, who are attacking the indigenous African people in Darfur. And the intention is to remove these people from their land. They're destroying the historical heritage. They are changing the demographic of the Darfuri people by raping women. Rape has been used as a weapon of war, systematically targeting women of young ages between 12 to 45 year old. And this has been like a tool and tactic of the war in Darfur by the central government that is like Arab supported. Also, it's not just the government of Sudan, but they are getting the support from the Middle Eastern countries like Saudi Arabia, Qatar, United Arab Emirates, and they continue to give their oil money to President Bashir so that they can advance the Arab agenda in Sudan, not only in Sudan, but also they are hoping of building this Arab Islamic belt that can extend from Sudan, Chad, Central African Republic, Mali, and Niger.
How is, let me just focus on one part of what you were just saying. How is rape being used as a weapon? And what rape seems to be, it's not just simply something that's happening, it seems to be an organized activity.
Well, yes, rape in Darfur has been used as a weapon of war in a sense of it is very systematic. There is a deliberate policy that is sponsored by the government and it is allied militia to use rape systematically. It is not random incidents or as a result of unorganized troops during the attack. It is very well orchestrated and systematically directed toward women. For example, like in October 31st of this year, just 2 months ago, less than 2 months ago, the government army attacked a village in North Darfur called Tabit. When they came to this village, they separated men from women. They beating the men with their arms and shooting randomly, terrorizing people, and they separated women. And in one night, they raped over 200 women. Most of them are elementary school girls. They're not even women, they are children. So it is very systematic, and this has been going on for these 11 years of attack against the people of Darfur. Rape has been endemic in Darfur.
Are there other economic issues involved in this war? Is there a fight for oil or any natural resources in Darfur, or is this mainly about displacing the population for other reasons?
Well, the first and number one reason is a racist Arab policy, but also Darfur is a very rich region. It has the most fertile land, agricultural-wise. We have been contributing to the country by over more than 40% of the general income of Sudan. And also there is oil, minerals, gold, and many more of natural resources in Darfur that people are competing over those resources. And now that the government aware of that resources, they are bringing more Arab from other countries to increase the Arab population number so that they can support the central government to be able to deprive our people from their resources.
What's the status of the opposition, and how strong or weak would you say both the opposition is, but also the al-Bashir government?
In a sense, right now, I think there is a large opposition of these indigenous African people from Darfur, from Nuba Mountains, Blue Nile region of Sudan. They allied together and created Sudan Revolutionary Front. They have their offices based in Uganda. The opposition has been very strong. However, the government allied with all the neighboring countries and also create the destabilization of South Sudan. So this has limited the opposition's ability to get support from outside, to be able to have the freedom of movement. So in a sense, the government of Sudan used oil money to influence regional actors, influence the neighboring countries around, trying to limit the space for the opposition. And there is another reason also. The international community has not supported the opposition. For example, the United States, they have supported the Libyan opposition, for example. Mm-hmm. They have supported the Syrian opposition that right now they are in trouble of like how to deal with that opposition. They have supported the Iraqi opposition. Unfortunately, that is not the case with Sudan. And I'm wondering myself like why Sudan is an exception. Because these are the people who are fighting for the legitimate cause. They are fighting for their right for their very existence as human beings.
What's the African Union doing, if anything?
Unfortunately, it is very sad. The African Union is divided. There are a few countries that are having a strong position, but the majority of African Union leaders are allied with the Bashir. And the problem is most of these leaders are dictators as Bashir themselves. Mm-hmm. So they are in fear of if they stood against Bashir and Bashir is being held accountable, tomorrow the accountability will come to them.
So for many of our viewers in the United States and Canada probably, the part of this that will be mystifying is that people like al-Bashir may self-identify as Arab but are very dark. So what exactly does this issue of race mean in a Sudanese context?
Well, number one, first, these Arab who are, even though they are dark, but they speak Arabic. They have no other language, and they are originally, they have Arab roots. So yes, they came to Sudan. They may have intermarriages, but they are still holding strongly to their Arab roots. And you can differentiate people by language, and that is pretty much obvious when they come. They are making jokes and also undermining the people, the indigenous African people, for example, the people of Darfur and Nuba Mountains and other people, because of the way of their speaking. So they can singly, you can be singled out to be arrested or tortured if just because of the way you speak. And that is exactly how they differentiate the Arab from non-Arab. So for the outsider, when they look at the people, they see like people are pretty similar and they have pretty the same color, but that's not the situation, that what it is in reality. When you are in Sudan, the boundaries are very clear. Yeah, the way people were allowing opportunities, people who have opportunity to have education, to control the economic, to have access to the civil servants and military. It is very obvious. Even if you have the best education, you cannot compete, and simply you have to fill in your tribe in the application for a job. And even like early on when we were sent to school, we were forced in one day to speak Arabic. And if you spoke your language, you can be eliminated. You can be beaten. We have been beaten and forced to speak Arabic. When you are a child brought to school, you only know one language that your family and your entire community speaks.
Yamat Mahdi, thank you very, very much.
You are welcome.
And thank you for joining us for this segment of The Global African. I'm your host, Bill Fletcher, and we'll be back in a moment, so don't go anywhere. In New York, there was panic that developed when it was revealed that there was a victim of Ebola. It was in the midst of that crisis that Dr. Mary Bassett, the health commissioner of the city, stepped forward and very concisely, very clearly helped to explain to the public the nature of the Ebola epidemic, what was at risk and what wasn't. We have the opportunity in this segment to discuss that more with Dr. Mary Bassett. It's a pleasure and honor to introduce our next guest, Dr. Mary Bassett, who's the commissioner of the New York City Department of Health and Mental Hygiene. With more than 30 years of experience in public health, Dr. Bassett has dedicated her career to advancing health equity. Dr. Bassett, thanks for joining us.
It's a pleasure. Thanks for having me.
So a few months ago, you came to national attention and praise in the way that you responded to the Ebola scare in New York City. And I was wondering if you could summarize how the events presented themselves and why you chose to respond in the way that you did.
I guess obviously we had multiple tasks in responding to the Ebola threat. The first one was to ensure that we were prepared and to work with numerous partners to ensure that we would be ready. And the other one, once we had a case actually diagnosed and confirmed by the Centers for Disease Control, our federal public health agency, our real task then was to manage public concern, which after the experiences in Dallas were verging on public panic.
What was your position on this issue that seemed to be spreading almost as fast as the virus, about quarantining people that had returned from West Africa?
There was a lot of concern about how to ensure that nobody arrived in the United States who had Ebola. And people's first initial response was, maybe if we throw up walls, we'll be able to keep this disease out. In my view, the world is too porous to ensure that we would never see a case. So our task really was to be ready and to ensure that people who had traveled to the areas where the epidemic was raging, at the time it was just 3 countries, that if they got sick here, if they had a fever or other symptoms, felt feverish, that they got to medical attention. So our view was always that our principal protection is to ensure that people know how to recognize the disease, seek care early, and that we remove people from the population, treat them, and then track down anyone who they might have had contact with. So this is old-fashioned public health, and quarantine really only applies to people who have had high-risk exposures. It's the idea of quarantining a whole country or a whole region. I think most public health people would agree is something that is virtually impossible to achieve and would also carry enormous risks of allowing an epidemic that was already raging to get worse. Because how would you communicate with the area where people desperately needed more solidarity from the world and not isolation if we quarantined them?
So when countries like Australia basically prohibited visas to West African countries and refused to let people in, do you think that there was a racial aspect to that? Was it panic?
You asked if I think it has a racial epidemic, sort of a racial component. And I think that what we learned here in New York is that people, first of all, didn't really know much about Africa. So we thought early about the possibility that anybody from Africa, no matter from where in Africa, that Africans would somehow be associated with Ebola based on simply their national origin. Now, of course, being African is not a risk factor for Ebola. A risk factor is being in touch with somebody who's sick with Ebola, and furthermore, with somebody's body fluids. So it's contracted in very specific ways. It doesn't come from the air, and it doesn't come from somebody simply being from Africa. So we really were concerned that as people become fearful, that they may start stigmatizing groups, discriminating against groups. And we started working to ensure that we were reaching out to communities to minimize that. There are all sorts of mythology around the dark continent as a source of disease. And I think it would be appropriate to think that people invoke them when they get scared. And a lot of that arose over the situation in Texas. Yeah. So a man came from Liberia, Thomas Eric Duncan, who sadly would eventually succumb to Ebola, who he traveled through Europe to Texas, and after arrival in Texas became sick. So this was our first imported case of Ebola in the United States. And he did the right thing. He sought care when he had a fever, but unfortunately he did not receive an assessment for the possibility he had Ebola, and he was sent home. And when home, he became sicker. And when he returned to the hospital at the time that he was diagnosed, he was subsequently diagnosed on his second trip to the hospital. He was quite sick at the time that he was diagnosed. And we know that people do much better when they're diagnosed and enter treatment earlier. And in the course of his care, 2 nurses acquired infection. The ones who cared for him after he was hospitalized, not the ones who saw him when he showed up in the emergency room the first time. Mm-hmm. So this made everybody very upset. A patient had appeared who had Ebola, who was not identified, isolated, or diagnosed, and instead was sent home. And furthermore, 2 health workers, despite the use of protective gear, which we all had in public health express great confidence in, because when it is used appropriately and people are trained in its use, it is in fact protective. But in spite of that, these nurses did acquire Ebola infection. They all survived, fortunately, but Mr. Thomas Eric Duncan died of his disease. So that was an experience from which everybody learned, including the CDC. And I'd say that it was because it was widely viewed as a series of preventable events that the CDC came under a lot of scrutiny. We have worked very collaboratively with the CDC. I have enormous respect for their director and for the protocols that they've worked with us to develop. And I think, though, that in New York, we had the opportunity to learn from Dallas. And we did a couple of things really differently. One is that we not only sort of told people what to do, the hospitals really worked hard at practicing with people. Mm-hmm. So they used mystery shoppers, people who showed up with a series of symptoms like the ones that Mr. Duncan had showed up with, that that hadn't triggered an evaluation. And so that was a way of testing whether emergency departments in our public hospital system would correctly identify people and manage them appropriately. And then we also began early reaching out to communities. And we did a lot of work reaching out to the West African community of New York City, and communicating with the community that, after all, was bearing the heaviest burden, since many people were losing family members back home. And we're also a community where patients might return home from, who we wanted them to be aware that they should seek care early, not worry about their immigration status or their ability to pay. And also we were concerned about returning health volunteers and reached out to those organizations. And we also had a really supportive political leadership that wanted to ensure that we were ready. And when we did have a case, there was agreement that we were going to stick to science, and we weren't going to panic, and we were going to keep telling people the facts. And I think we were able to do a pretty good job. Certainly our patient recovered. The subway system kept running. Right. And people, when when Dr. Spencer went home, all of his neighbors were delighted to welcome him home. I think that was sort of a tribute to to our outreach efforts and our communication efforts. So the CDC has, really had to contend with the experience of Dallas, and we got to learn from Dallas.
Dr. Mary Bassett, I want to thank you very much for taking this time with us in the Global African, but I also just want to thank you for the great work that you've been doing.
Thank you so much.
And thanks for joining us for this episode of the Global African. I'm your host, Bill Fletcher. Thanks for joining us, and we'll see you next time.